Assalamualaikum warahmatullahi wabarakatuh. My name is Rara Maharani from class 6C. In this video, I want to explain to you about the issues in the psycholinguistic. The title is Impaired Language Production in the People with the Depression. Depression is the mental disorder that can adversely affect your mood, thought, concentration level, and not being well be socially. And depression people in society have many factors that cause depression. One of the factor that is missing something loved or something needed. The problem of the losing your job can be contributing factor to depression. Moreover, in this modern era, someone is required to follow technological development if they are unable. Maintain it properly, it will have a negative impact. One of the most common effect is depression. With depression, human will be find difficult to produce language properly. And then how to how and then how is behavior related to personal behavior as the psycholinguistic picture. Scientists and the linguistics such as Listenberg and Wilson, 1986, said that those who experience depression show low self-control, namely negative self-evaluation, low performance expectation, like to themselves, and they give little appreciation to themselves. Depressive symptoms, namely behavior and the feeling that need specification, can be classified as depression. The symptoms of depression can be seen from the three aspects, namely psychological, and the social aspect. A person with this stage suffering from depression can feel a loss of energy and the feeling difficulty concentrating. A sign of the symptom of the thinking disorder are the change in the form of the activity levels, thinking abilities, and the speech or the speech production. A person who suffer of the depression will be dividedly have a have have a have the speech problem due to disordered brain process. The cause of depression, according to Mount 2007, mentions several causes of depression, namely disappointment that comes from the pressure, uh, the psychal picture, um, psychal pressure, or the cause, and the depression is associated with excessive mental activity. According to Riwadi 2008, female adolescents who experience pregnancy outside. From the point of the view language production, people with the depression procedure language freely regarded of the content. Patent do not pay attention to and carry out the strengths of the producing the language used by human in a general and the form of the conceptualization, formalization, articulation, and monitoring. Although the several languages they can still be understood phonetically, the patterns U-turns, but in the order to word and the sentence contain sound, some of the sound that are released are not structured. And the last, according to Maxman, 1986 classified depression into four models. First, endogenous and the reactive. Endogenous model depression is the depression that originates due to biological factor, and then reactive depression is the depression caused by psychological factor. And the second, primary and the secondary. In the primary depression, there is no predecessor, whereas the secondary depression is the preceded by physical illness and the mental illness. And this, in the third, unipolar and the bipolar. Bipolar depression is individual has a history of the episodes of the mania or the hypomania. Where in the unipolar model there is no period history. And the last, psychotic and neurotic. Depression is psychotic. Depression in the neurotic depression is a milder from the depression that the psychotic depression that is already so severe. Okay, that's all my presentation, and that I conclude in my opinion. The most significant cause of the person experiencing the depression is the individual accessory various negative life events such as disappointment, lack of self-esteem, never unfair comparisons to collecting feelings, illness, excessive mental activity, rejection, and disability access. I think that's all. Thank you for watching video. Assalamualaikum warahmatullahi wabarakatuh.